Dear friends, we are continuing with the topic diabetes. We are going to see what are the causes. The causes, what causes diabetes? What are the predisposing factors? If you understand that, we will be able to address also the problem. Once you know the cause of a problem, it's very easy to solve that problem. It's very easy to confront and try to fight it. You can't fight, you cannot answer the question that you don't understand. If you are given an exam, the first step is to understand the question. So we have a problem already, diabetes is here. Let's understand what are the causes, what are the predisposing factors, and see what we can do together. Again, African Motion, we are calling everyone, health professionals, those who have knowledge, to come together to see if we can uplift health education. Diabetes part 2, we saw what it is, diabetes in part 1. Now in part 2, let's see if we can understand the causes, the risk factors. The diabetes normally it doesn't start, particularly type 2, as we were saying. It does not just start from no reason. It will start on something. We have your blood sugar in the stomach, the insulin, either it's available, that's supposed to transport it to where it's supposed to go, as we saw in the previous presentation. We can see now the main risk factors is ethnicity. Some of the ethnic groups might have more diabetes because of genetic factors, but overweight. These ones which are highlighted in red, they are known to be the main risk factors of diabetes. We are going to see why. Why does overweight really matter? Why does it matter when it comes to diabetes? Increase the age. It's very clear if one is getting very old, the advanced age, the cells are getting old, that's the nature, that's the life that we have on this planet. Unhealthy diet, we become what we eat. If you eat healthy food, you become healthy. You eat unhealthy food, you become unhealthy. That's the reality of this, it's the nature, that's how it is. Physical inactivity. If one remains inactive throughout, then the joints, the organs will become inactive as well. That's the reality. So high blood pressure. There is a very close link with high blood pressure with diabetes. We will see it, how they link, how one affects the other, and all of them affect the whole body. The family history, we are talking about genetic factors. If you have a gene that will cause maybe the malfunctioning of the pancreas and the secretion of insulin, one understands what it would result in. Impaired glucose intolerance, if the absorption of glucose to the cells, if there is a problem on the metabolism, on how the body manages the blood sugar, then there will be a problem. The gestational diabetes, as we saw, it's one of the types of diabetes that we have. If you had or in the family, there is gestational diabetes when you are pregnant and you develop diabetes, and after delivery it stays, that previous history of having diabetes during pregnancy could explain why you developed diabetes. The poor nutrition during pregnancy, if you are not eating, the nutrition is not well during pregnancy, it can interfere on the sugar metabolism, on how sugar is utilized. These are the risk factors. If you have some of these and have a combination of some of them, then you are at risk of developing diabetes. But let's underline these ones which are in red, these ones. Can we do something about them? We will see in the next presentation. The main issue with the obesity and the overweight is a concern worldwide. But the studies that were done were showing that obesity in all groups, not only women, in all groups, men and women, particularly people above 18 years, we say that the diabetes that affects type 2 is mainly to the adulthood. So body mass index, we need to understand what it is. Body mass index is like a reference value that will tell you how much weight you should have according to your height. Now, they are showing us that in places where it is red, they have many people who are obese. The more it becomes red, the more the serious, the more risks of getting diabetes. You see, in some areas, you have 25%. You have 100 people, 25 of them, they are obese. They are overweight. The weight is more than what it's supposed to be. Then that will expose to this condition, particularly diabetes. These are the data from World Health Organization. And the challenge that we have, these things are increasing on a very high speed. Should we do something about it? To understand what the body mass index is, but do you understand? Body mass index, what is it? The weight that you are supposed to have in connection to your height. Let's say we are going to see a little bit on how to calculate it so that you can, have an idea. If you have the value that we are going to calculate, if your value is below 18.5, you are severely underweight. Your weight is too low. We don't need it as well. It's not normal. But if your weight is between, your body mass index is between 18.5 to 20, it is underweight. It's not very severe, but it is underweight. The one which is preferable, the one which is recommended, should be between 20 to 25. Now, if you have the 25 to 30, you are in the category of overweight. Then obesity is into three classes. Obesity type 1 will be 30 to 35, class 2, 35 to 40. Anything above 40 is obesity class 3. So we need to understand this so that we understand the severity, the impact, the implication they have on the diabetes. Let's see. Body mass index, let's suppose you have a scale. You go on a scale, you weigh what is your weight, what is your mass in kilograms. Then you take your height. But your height, you have to divide in meter square. You will take the mass you got in kilogram, then you divide by your height in meters squared. Then the answer you will get, for example, let's say you have 60 kilograms. If you are 60 kilograms and your height is 1.6, you will take 60 kilograms divided by 1.6 meters, but this number, you will square it, which means 1.6 times 1.6. This is what we get. If you take 1.6 times 1.6, the answer is 2.56. Then what we do, we take this number, we divide by that one we saw, the result, we'll get 60 divided by 2.56, the answer is 23. 23. Then you go back to the reference values. You ask yourself, is my BMI in the normal range or it is out of the normal? So if it is overweight, it is telling you, be careful, you are almost going to obesity. We saw that the normal should be between 20 to 25. So this one is normal. So the risk factors are minimal. Where do we get elevated BMI? Is into what we eat. What we put in our bodies is what will be reflected outside. The main reasons that we get obese is fat that we consume in what we eat. fat consumption, or consuming a lot of sugar, food containing a lot of sugar, the body will transform that sugar into fat. After utilizing the little that the body is in need of, the remaining one, the body transforms it into fat. Now you can see what happens. If the fat is all over the body, remember that organ, pancreas, which secretes insulin. If this fat is also covering that pancreas. We did study in the previous presentation what is diabetes. Is that organ now, the pancreas, is covered completely by the fat. So how will insulin be produced? It will never come out. Then if it comes out, you need to depend on the insulin from outside. There is nothing that will be available to transport the sugar from the blood vessels to the cells where it needs to be utilized. This is what we say, let's make it simple. Let's make medicine so simple that everyone can understand it. The fat consumption is a problem. Not only fat, the sugar. These things that we eat, though they are sweet, though they taste nice, but the benefit is limited. We need to be careful, we need to be watchful, we need to wake up, and we need to be realistic and know, we face the reality. We need to be honest to each other, we tell each other the truth. So these are the risk factors that predispose us to get to diabetes. If you manage to fight until your BMI becomes normal, you are winning. You are in the group of winners. I'm again encouraging everyone who is viewing this video, who is seeing this presentation. If you find they are useful, please share it with somebody who has diabetes. Share it with somebody who has a family member with diabetes. We need to understand this topic. Without understanding them, medications alone will not work. That's the truth. The medications are very good. They are very important, but there is nothing better than prevention. Please, and I'm calling again the health professionals to come on board and help each other, make a difference. The knowledge that is not utilized is useless. Thank you very much.